Good morning, everybody. New South Wales yesterday, we had 120,000 people that came forward to get vaccinated, and we can't stress enough how important it is for that to continue. We're now at 5.7 million jabs in New South Wales, which is 55% first dose across the population, and nearly 30% are fully vaccinated now in our state, and we desperately need to keep these numbers going up. Unfortunately, overnight, we did see an increased number of cases, 825 in the community, with at least 58 of those infectious during the entire time. Tragically, 3 people lost their lives overnight, a man in his 80s, a man in his 90s and a female in her 90s, and we extend our deepest sympathies to their loved ones, and Dr Marianne Gale will comment in greater detail on those issues. The suburbs of concern in Greater Western Sydney and southwestern Sydney remain the same, and we urge everybody in those communities just to appreciate that every day they set foot out of their house, they should assume they're going to come into contact with somebody who has the virus, and that is a fact. It's not just an assumption. So Blacktown and the surrounding suburbs, Auburn, Guildford, Merrylands, Yagoona and Greenacre. And of course, our concern remains high in relation to Western New South Wales, and the Deputy Premier will speak about the regions. We have seen a stabilisation and lowering of cases in parts of regional New South Wales, but that far northwestern part of the state remains a very, very grave concern. Can I stress again how important it is for us to focus on getting our vaccination rates up? We know that vaccination is preventing hospitalisation and vaccination is preventing death. And no matter what any of us say, the Delta strain is like nothing Australia has seen before. And even in very strict and harsh lockdowns, the virus is spreading. And that is a fact. So what we need to do is protect ourselves and our loved ones by staying at home and also by getting vaccinated, but also being assured that once we hit that 70% double-dose vaccination, that 80% double-dose vaccination, our national plan says we live freely or more freely than what we are now. And that is absolutely what we need to stay focused on. I was very pleased to learn that overnight, Service New South Wales sent 1 million texts. 1 million text messages went to people 16 to 39 years of age in those local government areas of concern in Greater Southwestern and Western Sydney to allow them to get priority access to the vaccine. And we urge everybody to come forward. I understand we've already had 230,000 bookings with the extra Pfizer vaccine that we received, and we want to make sure that everybody takes up the opportunity to get vaccinated, especially, of course, in those local government areas of concern. We're also making sure that across the state, not only that people have equal access to vaccines, but that everybody moves forward together to make sure that communities are protected. Because when we do start opening up, we don't want the unvaccinated to be unprotected. Everybody should get vaccinated now. Don't be fussy on the vaccine. Go forth and get vaccinated with any vaccine that is offered to you. But please make sure you do it as soon as possible to protect you and your loved ones, but also to make sure that we get quicker to our goals. At this stage, if current rates of vaccination continue, New South Wales gets to 70% double doses by the end of October and 80% double doses by mid-November. And of course, if we work harder and faster, we can bring those dates forward. And I'm looking forward next week to talk about what our plan for schools looks like, also what we can do in terms of offering people a bit of relief once we get to the 6 million jabs. So I extend to everybody my deepest appreciation. The vast majority of people are doing the right thing. The vast majority of people get how important it is to stay home, and I receive messages every day from people who express their personal circumstances about how difficult it is. And it really breaks my heart hearing some of the stories, but the bottom line is they know they're doing it for the greater good. And I just appeal to everybody, please consider the greater good. Only a handful of people are doing the wrong thing, but it's having catastrophic consequences. And we really need to make sure that by the time we start opening up, the case numbers are as low as we can get them, because then that means we're not leaving the unvaccinated vulnerable, and we want to make sure that nobody who wants to get the vaccine doesn't get the vaccine before those dates. So please come forward and get vaccinated. Dr Gale will give the health update. Deputy Premier will talk about the regions. Deputy Commissioner Warboys will talk about police activity overnight, and unfortunately a few instances of people still doing the wrong thing, leaving areas of concern when they shouldn't be, entering mass gatherings when they shouldn't. And also then, of course, the Health Minister will conclude the updates, and then we'll take your questions. Thank you.
Thank you, Premier, and good morning, everybody. There were 825 locally acquired cases of COVID-19 reported in New South Wales in the 24 hours to 8 p.m. last night. There were also 7 overseas cases. To 8 p.m. last night, there were 124,610 tests reported. So again, a big thank you to the people of New South Wales for continuing to come out to get tested if you have even the mildest of symptoms. In terms of cases in hospital, there are currently 516 cases admitted to hospital. 85 people are in intensive care, of whom 29 require ventilation. Of the 85 people in ICU, 76 are not vaccinated, and the remaining have had 1 dose of vaccine. Sadly, to 8 p.m. last night, we have become aware of 3 people who have died. They are a man in his 90s from northern Sydney who died at Hornsby Ku-ring-gai Hospital. He was not vaccinated. A man in his 80s from northern Sydney also who died at Hornsby Ku-ring-gai Hospital. He had received 2 doses of vaccine. Both of these men were residents of Greenwood Aged Care in Normanhurst and had acquired their infections at the aged care facility. Both men also had significant unrelated health issues. The third person who sadly died is a woman in her 90s from southwestern Sydney who died at Liverpool Hospital, and she had received 1 dose. She was a patient in the geriatric ward at the hospital, 10th death related to the outbreak. To all the families of those 3 people who have passed away, I extend my deepest sympathies and sorrow for your loss. These deaths bring the number of COVID-19 related deaths to 68 since the 16th of June, and a total number to 124 lives lost since the beginning of the pandemic. To provide a bit more detail about the aged care facility in Normanhurst, these 2 deaths follow an outbreak after a staff member worked 2 shifts while unknowingly infectious with COVID-19. That worker unfortunately wasn't vaccinated. A total of 6 residents have been diagnosed with COVID-19. All the positive patients are residents of the 14-bed dementia unit within the facility. 4 of the 6 positive residents were not vaccinated as they had declined to be immunised. In terms of the suburbs of concern, as the Premier outlined, we remain particularly concerned about areas of Western Sydney and southwestern Sydney, and particularly encourage residents who live in the Blacktown or surrounding suburbs to please be vigilant for symptoms and come forward for testing. Also residents in the Auburn, Greenacre, Yagoona, Guildford and Marylands area. I'd like to also note that we have had an unfortunate event where we've got 16 people who attended a gathering in Maroubra last Saturday, the 14th of August, who have now returned to positive COVID-19 results, and a number of their contacts have also tested positive. So contact tracing and further testing is underway, and I'd like to particularly ask residents of Maroubra, Malabar and the Matraville area to please come forward for testing and isolate should you have even the mildest of symptoms. And as a reminder to people, we know that the vast majority of people in the community are absolutely doing the right thing, following the health orders, coming forward for testing, getting vaccinated. There remain a small handful of people who are not doing the right thing, and we ask you again very sincerely, please do not gather, please do not have parties, please follow the public health orders for yourselves, for your family members, and for your community. So please follow the public health orders, please get tested, and please get vaccinated as soon as you can with whichever vaccine is available to you. Thank you.
Well, good morning, and can I start by offering my deepest condolences to the families that lost loved ones overnight, and you remain in our thoughts and prayers. Again, up to 8 p.m. last night, which is the recording period, we have grave concern about the far west and the western part of New South Wales. Western New South Wales Local Health District, there were 38 cases reported to 8 p.m. last night. There were 32 in Dubbo, 2 in Bathurst. Since this morning, since the reporting period of 8 p.m, we've been advised this morning there's a further case in Bathurst, and there'll be more said later this morning. There are 2 in Wellington, 1 in Walgett and 1 in Narromine. In the Far West Local Health District, 14 cases, 12 in Wilcannia and 2 in Broken Hill that we mentioned yesterday. Those cases in Wilcannia continue to concern us. We know there was an event in a gathering in Wilcannia, and we know that people travel from all over regional and rural New South Wales to Wilcannia and now have returned home. So for anyone that lives in Wilcannia, the message is get tested regardless of symptoms. Come forward. We need to get on top of it. This is of concern not only to the Far West but to the rest of regional and rural New South Wales. The Central Coast had 1 more case, but that was one that was of a close contact. Now, there's a good example with the Hunter, New England. There was 1 case in Newcastle. This particular person was in isolation throughout the whole infectious period. Going back a few weeks ago, we had days in Newcastle that we were reporting over 20 cases a day or 10 cases a day, and it clearly shows that the lockdown and the restrictions put in place in the regions and the extension of those lockdowns has actually protected that community, more importantly, lowered case numbers. So it's a great example of the local health district, the team on the ground, but also the community doing the right thing. And my message to everybody in regional rural New South Wales, the reason for the lockdown, the reason for the restrictions, you may not have a case today, is to make sure that you never get a case in the future. And that's why the restrictions play an important part. Southern New South Wales, there were 2 cases in Goulburn, but they were also reported yesterday. And in Illawarra, Shoalhaven, overnight, 1 case in Kiama, which was, of course, a close contact. We have concerns to our sewage detection, which hasn't let us down to this point. It has been an important tool in identifying areas of concern, and our focus now is in Orange and Lithgow. And again, the message for anyone in Orange and Lithgow, if you're not feeling well, if you don't feel right, please come out and get tested. We need to get ahead of the curve in our regional and rural areas. We've heard already this morning in Victoria, numbers are up, but alarmingly, numbers in regional Victoria are of concern, and that does threaten the New South Wales-Victoria border. And to those communities on the border, please be vigilant, get tested, minimise travel, follow the restrictions, follow the stay-home orders. It is about protecting you and your communities and your loved ones. Again, the message to everybody in regional rural New South Wales is to get vaccinated. Get online, book, so that we can continue to raise our vaccination numbers, not just here in Sydney, but right across regional New South Wales, and help us stop the spread.
Thank you, Deputy Premier, Dr Gale, Minister. 681 penalty infringement notices issued in the last 24 hours right across the state by New South Wales Police. More than 50 court attendance notices on top of these infringement on-the-spot fines issued and being prepared today to put people before the courts. Of significance, more than 400 of those notices were again for people being outside of their home without a reasonable excuse. This is people moving around the community, and some examples of people moving out of those LGAs of concern into neighbouring LGAs for no other reason than to gather, to have a celebration or a party, whether that's a graduation in one instance, whether that's people coming together for a dinner party in another, or just simply a party arrangement up at Tweed Heads. These people are moving around in contravention to the public health orders. They are being dobbed in by neighbours and people who know these events are occurring. So one of the events was at St George, another at Sutherland, another in the Hills District, and one, as I said, up at Golden Beach at Tweed Heads. Right across this state, there are clearly people who either don't care or, in fact, are quite happy to be in this arrangement for however long. Every single person has a part to play. Every single person, no matter where you live in this state, you have a part to play to see that the state comes out of the crisis as early as it can. The other part that people need to understand is when they leave their home, they need to have a look back inside that home about the people who they will bring the virus back to if they choose to go to these party events, particularly those that come from affected areas and travel across LGAs. New South Wales Police will continue the stay-at-home operation. Incredible amount of resourcing going into that operation right across the state. The message is quite simple. Unless you have that reasonable excuse, stay at home, play your part in what is truly now an event that spreads right across this state. Thank you.
Good morning. I'd like to start by just expressing my sympathy to the families of the people who have died in the last 24 hours as a result of the continuing spread of Delta 19, and particularly to those families, I say, our thoughts are with you. Can I just say, by far the majority of our community are doing what they've been asked to do. They're making sure that they try to stop the spread of the Delta virus. But there are those amongst us who don't seem to give a damn. They are out attending parties, they are out doing what they've been told not to do, they're facilitating the spread of the virus, and I would just say to them, you are ransoming our future. You are making sure that none of us can get back to a normal life. Can I also say to the broader community who are doing the right thing, these people who don't give a damn about our future, your future, mean that you must go and get vaccinated by whatever vaccine is available. We are in a very serious situation here in New South Wales with this particular variant of the virus. And if you can get either one of the two vaccines that have been made available, just go and get it. Just go and get it. If you fit within the categories that have been advised, go and get the vaccine. Can I express my very strong disappointment on behalf of the health staff? The health system in New South Wales is stretched. That means that each and every one of your doctors, your nurses, your administration people, the people who are looking after you in hospitals, the cleaners, are all having their lives put in a very precarious position as a result of a number of people who are deliberately not complying with what they've been asked to do. The Maroubra Party, 16 positive cases to date. I'm hearing there could be up to about 60 people who attended that party. Another funeral that occurred in Western New South Wales, I'm hearing that there could have been up to between 350 and 500 people at that funeral. Each of these people who are going to these functions must understand that they run the risk of either having the virus and transmitting it, or getting the virus and taking it home to their families and their communities. In the case of the funeral that occurred in Western New South Wales, many of those people are now returned to the far-flung parts of our state. And I'm already hearing from our health system that there are cases that are positive in various communities, and those will probably grow in the next few days. There is no time now to be selfish. It's time to think of the broader community and your families. If you are actually spreading the virus, you could be responsible for people's deaths. The person yesterday who has now had a notice under the Public Health Act making his face public is exactly the opposite of what our health team want to do. As many of you would know, over the course of this long pandemic, the health team here in New South Wales, the people who keep you safe, have been very careful not to name individuals, because that's what health people like to do. They like to keep your privacy. But this 27-year-old chap who apparently has expressed the view that he doesn't care less whether he spreads the virus, is one example of the worst of the worst. I have to say to you that if we have got to the stage of our Chief Health Officer having to issue notices requiring the police to actually go out tracking down an individual who just doesn't care whether he spreads the virus, and that's what apparently he's been saying, then I think we have reached a very poor state in the development of this particular pandemic. So to all of you who are out there who are doing the right thing, thank you so much for doing that. We will get through this. We will get through it. There's no doubt we will get through it. But we need people to get vaccinated. We need people to stay in their household. We need people not to go visiting other households, particularly in the local government areas of concern. We know that just in these very dramatic numbers that we've heard overnight, more than 75%, in fact nearly 80% of the people who have tested positive are in the 8 local government areas of concern. So there is an absolute need for the people in that area to actually comply with the orders. But again, I just want to say thank you to by far the majority of people who are, and the people who aren't are letting us all down, and particularly letting their local communities and their families and the broader state of New South Wales down. Thank you.
Premier, 825 new cases today. That is now a record in Australia since the pandemic began. People are watching this press conference at home every day, turning to you as the leader of this state for some level of hope, but the numbers are going up. You announced tough restrictions on southwestern parts of Sydney yesterday. If we are all in this together, why isn't this a blanket rule across the state to reduce mobility?
What is really important to note that whilst case numbers are going up, the more important figure that's going up is the vaccination rate. The vaccination rate is where we can look forward to living life freely. And what we need to do is to make sure that when we get to that 70% double dose in New South Wales and that 80% double dose in New South Wales, that we try and keep the case numbers as low as possible. But what we do have to also accept is how we actually talk about this disease moving forward. And once you get to 70% double doses, it will be a situation where the vaccine rate will be more critical than how many cases we have. The key measure for us is to keep people out of hospital. That's why we're saying to everybody, please come forward and get vaccinated, because what we've seen around the world, and unfortunately Australia is no different. Until this point in time, we've had relatively good success compared to other parts of the world, and even today we do. But we are not immune from what this virus does. We've seen examples in other parts of Australia where even under very strict lockdown conditions, the virus keeps growing. That's how insidious it is. But what is important for us to focus on is, are our loved ones vaccinated? Are you vaccinated? Come forward and get vaccinated, because that is how we live life freely. And when we get to that 70% double dose, when we get to that 80% double dose, we want to make sure as many of the vulnerable in our community are protected as possible, because no matter which state you are, even if you're in a state where there's 0 cases now, once you open up your borders, once you let people move in and out, Delta will take a hold. And then it's not so much the number of cases that's relevant, but it's how many people you keep out of hospital, because you've got very high vaccination rates. And I can't stress that enough. And yes, none of us like to see case numbers going up. But unfortunately, this is the reality of the Delta strain. This is what happens. And even when you start off with a handful of numbers, and there'll always be debate about going too hard, going too soft, going too early, going too late. But we started off with 11 cases in New South Wales, 17 overnight when we went to lockdown. And it just demonstrates that no matter how hard we work, and no matter if 99% of people are doing the right thing, there's an element of Delta that nobody can control. And that is what we have to accept. And the best way we can protect ourselves, the best way we can look forward to freedom, is by making sure that we get vaccinated. And I can't tell you how proud I am of the number of people that have come forward in the last week. And if we keep these rates up, there's a chance we can even hit those deadlines earlier. And having conversations with my cabinet colleagues around the nation, there is definitely a change in attitude. In the last couple of days, I've noticed a change in attitude amongst all of us. We accept the Delta is here. We accept getting to 0 across the nation, especially once you open up and live freely, will be an impossible task. No other place on the planet has done it. and we are one of the best places on the planet to be in terms of managing this. We just have to be real about it. And rather than getting fixated and panicking, what we need to do is stay calm, because we know what works. Getting vaccinated is keeping people out of hospital. Getting vaccinated is making sure that we keep people alive. And we always fear for the most vulnerable, our elderly, our people with underlying conditions, people who aren't vaccinated, people who live in remote parts of our state that have special needs. But at the end of the day, the more of us that get vaccinated, especially, can I say, and this is why Service New South Wales sent out a direct text or SMS last night to 1 million people, is especially if you're between the ages of 16 and 49 in those 12 local government areas of concern, you get priority vaccine. We are so keen for you to come forward and get vaccinated, because you're protecting you and your loved ones in those communities. And the people in those communities, again, my heart goes out to every family, because the vast majority are doing the right thing. But unfortunately, the risk is very high. And the more of your friends and family that get vaccinated, the safer we all will be. So I think it's really important for us to focus on what Delta means and be real about it. And I'm the Premier of the largest state in Australia, and I expect to be held to account. I expect for every decision that we take to be scrutinised, to be commented on, but I also need to be very real about what Delta is and what Delta is doing. And I want to thank the other state premiers who I've noticed have a shift in their attitude about what Delta means and how closely all of us have to work together. And I want to thank the Prime Minister also for appreciating that working together, and his support in terms of making sure that we get those vaccine doses up is key to us living more freely. And if New South Wales has had to go down this journey the earliest because of the size of our state, because the way the outbreak has grown in New South Wales, so be it. But we're up for the task. We've been through a lot in the last 2 years, and not just with the pandemic, and we've come through every single time, and we will get through this. The biggest challenge for us as a government is to make sure we keep the community positive and keep the community going during this very difficult time.
Dr. Gale said on Thursday that the virus is not spreading from people doing the wrong thing for the most part. It's spreading in essential workplaces and in households. So why the very next day was there a further police response and tightening?
Yeah, I think it's important to note that across the board we need to attack the virus with every weapon we have, whether it's through the excellent health workers, whether it's through all of our social services, and whether it's through police and compliance. We have to fight this war, this invisible war, with every single weapon we have, and that's why we need a whole-of-government approach, including police. And what we also do have to accept, yes, a handful of people are doing the wrong thing, but also what the Delta virus tells us is that, unfortunately, you can be contagious, not know it without having any symptoms. And that's why we have to assume every time we leave the house, that we have the virus, or somebody we come into contact with has the virus. And that's really important to know. It is a combination of things that spreads the virus. It's people, a handful of people doing the wrong thing. It's also people perhaps not appreciating how serious the illness can be and how quickly you can catch it and pass it on without even having symptoms. Your symptoms may not set in until after you've been contagious. And these are different things we're seeing with the Delta strain we haven't seen with previous COVID strains, and that's really important to note. As a government, it's really important for us to be very direct with the community and explain exactly where we're at, but also where we're going. And the 70% double dose, that 80% double dose of vaccination rates will mean freedom for people of New South Wales, but also for Australia. And we know that every state is playing their part in getting the vaccination rates up. And I know that Premier Andrews is playing his part as well as his government. But let's not pretend that we are immune from Delta, and let's not pretend that it doesn't take every part of society working together. This is a team effort. It always has been and always will be.
So what's the weapon in workplaces? Just to follow up.
If this is a team effort, there's people who live in South Western and Western Sydney who are bearing the brunt of facing these harsher restrictions. We heard just earlier that there's been gatherings in Sutherland, in Hills District Shire, Tweedheads, this Maroubra party. The minister said there was up to 60 people who may have been there. Why are the people in Western and South Western Sydney bearing the brunt of this? Why is it not blanket rules for everyone so that it can be a preventative measure that's taken now to ensure that this doesn't keep going the way that it's going?
Well, firstly, unfortunately, a lot of people who attended those illegal gatherings actually came from the 12 local government areas of concern. And that is what shocked us most when we heard about them. Unfortunately, people left those local government areas of concern and attended gatherings in other areas illegally. And fortunately, the police got on top of it.
Okay, but that would mean that
Yeah, I'm still finishing my answer. Yeah.
still.
But also, when we know that 80% of cases are coming from the same part of Greater Sydney, it means that's where we need to put our resources and focus. Because when you are in a pandemic, all of your resources are stretched. We have thousands of police involved in this process. Every single health worker is involved in supporting the pandemic. And when you have outbreak where between 70 and 80% of cases a day is coming from the same area, that's where you need to put your resources to reduce case numbers. Otherwise, you're spreading resources across a very large area when you know the key area where you need to address those cases is geographically within the same area. And the one thing about the pandemic we've learned a lot in the last few weeks is the consistency of where the case numbers are popping up. But that's why it's a very big concern, which is why everybody across the state is in lockdown, everybody across the state has to wear a mask outdoors, everybody across the state has very strict rules to live by. Let's not forget that every person in New South Wales is now under a strict lockdown. But in those areas of concern, we need to put extra resources, both in supporting the community, and we are, but also in how we are addressing the particular issues which will hopefully address reducing the case numbers. And that is why the policy is there the way it is. Because if you unnecessarily spread things across a greater region than what you need to, it means you're not putting resources where they're needed the most. The virus moves, we will move. But please know that every single person in New South Wales is under lockdown. Every person in New South Wales can't leave the house without wearing a mask. Every person in New South Wales has to assume that when they set foot outside their door that they have the virus or somebody they're coming into contact with has the virus.
Tabby, is this not a tale of two cities right now? You're talking about harsher restrictions for some areas, and you're also at the same time talking about potential freedoms at the end of this month for other areas. You're dividing the city.
No, what's important for us is to get vaccination rates up across the state, and that's why, can I say, in terms of vaccinations, the people in those, our citizens in those 12 local government areas are getting absolute priority. So I know that everybody wants to get their hands on a vaccine, but we are making sure, in a timely way, we're making sure people in those communities get the vaccine as quickly as possible, especially 16 to 39-year-olds, because that is key to reducing the spread and keeping families safe, because they're the people most mobile, authorised workers and the like. But we also need to work hard to keep vaccination rates high across our rural and regional communities and all parts of New South Wales, because we want to make sure that when it is time to open up, that we're not leaving communities behind and we're not leaving the vulnerable behind. And that's why it's really important for us to be very, very thoughtful and considerate in how we're managing resources, where they're best placed, and our ambition to vaccinate 500,000 people between the ages of 16 to 39 in the next fortnight is a big ambition, but we're up for the job because we know it will make a big difference, and we know that it will keep people alive. And if you look at where our vaccination strategy is, if you look at the positive resources we're putting in, we are supporting those communities to make sure that they are safe, their loved ones are safe, and that we also move together in getting out of this lockdown as quickly as possible.
What are you doing in workplaces, please? You mentioned the whole of government approach, so what's the special weapon for work?
Well, obviously for workplaces, we're working with industry in relation to rapid antigen testing. We're also working with industries in relation to vaccinating their population of workers, and that is really critical. And industry has stepped up. A number of companies have made decisions about how they want every single one of their workers to be vaccinated. So we are working with industry, we're working with community organisations, we're working with community leaders. No one's going to pretend the situation we're in is easy. But every single country, every single state around the world has been through this. And what the challenge for us is to make sure we prevent people ending up in hospital, especially when our state starts opening up. And every single state is going to have to come to terms with the fact that when you reduce your borders, when you start living freely, when you start allowing Australia to be one nation without internal borders. This is a national issue, and Delta, unfortunately, is something we need to live with. And I stress, I'm grateful to my colleagues in National Cabinet. I noticed a seismic shift in the way people are now approaching this issue, because irrespective of the rules you have in place, irrespective of every intention, good intention, to get the case numbers down and to reduce the caseloads, and I'm still confident we'll do that, absolutely we will. But the journey is a difficult one because Delta moves in different ways, and even very compliant societies like ours around the world have seen thousands and thousands and thousands of daily cases. Jurisdictions the size of New South Wales have seen thousands and thousands and thousands of daily cases. Now, our job is to make sure, and this is key, that we keep people out of hospital until we get those vaccination rates up. Whilst we're in lockdown, we're buying ourselves time to get our vaccination rates where they need to be, and then we can move forward and live freely. And that is the target that all of us need to work towards. And I'm incredibly pleased, as I said, to thanking everybody for coming forward and getting the vaccine, for making the effort, and especially if you're in those local government areas of concern, please know you have priority. You're our priority to keep you safe, your family safe, and also to help you during these difficult times, to reduce the fear that people are living with, to show that there is hope at the end of this dark tunnel, and there absolutely is. The end of October, to have 70% double doses is not only an achievable target, but if we work extra hard, we might even be able to achieve it before that day. But it's really all of us working together, making sure that we provide and we continue to provide the extra resources in those areas we need, put the extra resources in to support our communities, but also, obviously, for all of us to protect our loved ones and ourselves by getting vaccinated.
In order for them to complete vehicle checks. Truck drivers are saying they're not being made aware of these closures. They're planning on using this as their key rest stop. They're having to drive an extra hour illegally when they need to legally take their rests. Why aren't truck drivers being made aware of these changes police are making, and what will you do to make sure that truck drivers can still take their legally needed rest?
Right, there's a fair bit in that. But what I can say is that what is paramount to the state and police right across this state, Traffic and Highway Patrol and local police are well aware that to continue to allow the supply chain of goods and services across the state and into other states is vitally important for us to get through this pandemic and for people to see resupply. Only yesterday I had conversations with our Police Operations Centre and various others about this very issue, and I would say that as we move forward over the weekend, truck drivers will be allowed to access food, showers, places to rest, and make sure that their job to move goods and services, goods and freight right across the state is as simple and as easy and as safe for everyone as possible. Yeah, what I can say is that there's a significant response in terms of the protest activity that may or may not happen today. New South Wales Police have been working on that for many days now. It is quite clear through the messaging that it has been sent to people that it is not an authorised gathering. It is clearly not what the vast majority of people want to see in this state, is people come together in that proximity, in those numbers that they perhaps may like to. Right from early this morning, police were briefed and are at various spots around the outskirts of Sydney, and there'll be a significant number of police in places that hopefully people will take notice of, not just notice of the fact that the work that's gone in around preparing people not to come into the city, but if they choose to do so, they will be met by police, they'll be turned around, and if need be, they'll be issued infringement notices.
Deputy Premier, can I ask you just a question, please? In regards to regional permits, people were able to apply for those from last night. There's no telling when they'll actually get them. For people
Yes, there is. I mean, Commissioner Fuller yesterday said that the permit system, firstly, you can go live now on the Service New South Wales website. It's a self-assessment. You tick the boxes and you print the permit, so people can get them. And if they haven't and they've left home and they've been travelling, that's fine. And Commissioner Fuller said that as long as you have the permission to leave, that you do fit the category to leave, then we're not going to go hard on the first couple of days on the permit. But the reminder to everybody is that it's not just the permit, it's also that you must have had a test in the previous 7 days of leaving. So there are a number of requirements for those that are actually accessing the permit system. And when you do fill out the permit system, if you lie on it, there are significant penalties.
Minister Hazard, there were 25 people on a shearing station. We've been told about a situation where one of those people in Wilcannia on this shearing station has tested positive. Health has told them to all isolate on that property, but there's nowhere for them to actually sleep. They're all bunking in together. They're all very nervous. You know that these situations in regional areas are very different to cities. How are we dealing with these situations as they come up?
Well, we've had to deal with those situations previously, and I don't know the details of that particular event, but when there is a case, and if they're isolated in a workplace, we isolate them in that workplace. We had a situation only a couple of weekends ago, a mine in Boggabri, where there was a case initially reported, and it came back false, can I say, but that took 12 hours, and we kept all that workforce on site for 12 hours until such time that we were able to get a confirmation of the test result. Now, without knowing if it's positive, if the test result's been confirmed, if it was part of the numbers this morning that we've announced for Wilcannia, I'm happy to come back to you with further information.
Premier, are you able to talk more about the sort of relief that you might be announcing this week and whether school kids will go back to school this term?
Look, as I indicated, towards the end of this week, the New South Wales Government will outline where we foresee schooling or what schooling will look like in September and October. And we'll be discussing that publicly towards the end of this week, in addition to what we'll be doing once we get to 6 million jabs.
Premier, have you lost hearts and minds in this lockdown? It's been 8 weeks. There are numerous illegal gatherings. People are tired. They've got fatigue. Have you lost the population?
I'm so grateful that every day we are having more than 100,000 people come forward to get tested, and more than 100,000 people coming forward to get the vaccine every single day. And I know how much all of us want to get out of this lockdown. I also know how much all of us want to protect ourselves and our loved ones, and I'm deeply grateful for that. I'm so deeply grateful that the vast majority of people are doing the right thing. And whilst it's a very difficult set of circumstances, our strategy is to buy time whilst we're in the lockdown to get our population vaccinated so we can open up and live life freely again. And that is the end game. But what we need to make sure is by the time we get to living life more freely and opening up, that we've vaccinated as much of our vulnerable population as possible and that everybody has had access to the vaccine. And that is the strategy that I think people understand, that to get out of this as quickly as possible, we need to get those vaccination rates up, and we've been saying that for a long time, and that's really important. But I'm so deeply grateful. If you look at our vaccination rates in New South Wales in the last couple of weeks, they've been up there with some of the highest vaccination rates in the world in terms of what we're doing every day per population. That gives me enormous heart. And can I just thank the citizens of New South Wales for allowing the government to keep doing what we're elected to do, is to work hard for you, to get on this journey, which is very difficult for all of us. But it's a journey that unfortunately every community on the planet is either going through or has already been through. And now we look around the world and we see people living freely, and I know we look around the world hopeful that that will be us soon, and it will. And whilst I know lockdown is hard, I appreciate how difficult it is for everybody. I'm so deeply heartened that people are literally acknowledging the call to arms, coming forward and getting vaccinated, and vast majority doing the right thing. And I can't tell you how grateful I am for that, because it takes a lot for people. And again, I get messages every day from people explaining their personal circumstances, their heartbreaking circumstances, but the bottom line from them is, but we know we're doing this for the greater good. And all of us are appealing to everybody's sense of greater good. And I'm so confident we'll get through this. And whilst New South Wales has had to face these challenges first, that is not a surprise given we are the largest state and Sydney is the gateway to Australia. But to have the notion that we're somehow different from the rest of the world, that we're not going through a difficult path to get to freedom, to get to no more lockdowns, I think we have to be real about that. And our path, the most difficult part of our path is right here and now. Because once we hit 70% and 80%, we'll know people won't be in hospital at those rates that they may be now when we have those high rates of vaccination. And our key thing is to keep people safe and alive and to make sure our economy bounces back as quickly as we can as well. But that is dependent on how quickly we can all get vaccinated, and that's why I've actually gained heart. I get inspired every day by ordinary people making huge sacrifices. Single parents, homeschooling, keeping jobs going, getting money on the table. I mean, you could go through the list. People everywhere are doing it really tough, but we also know that when we work together, when we focus on what we need to do, we are at our best. And New South Wales, ironically, has the opportunity to demonstrate how it can happen in Australia, because whilst our case numbers are high, our vaccination rates are really high. And we have the opportunity to live life freely, but also to show that in due course, it's not the case numbers that'll matter. And this is what the Doherty report says. The Doherty report says once you get to 70% double dose, you transition to counting the number of people in hospital, because then you can think of it in the context of being like the flu. I mean, every year, tragically, we lose between 600 and 800 people to the flu every year. And in due course, when enough of our population is vaccinated, the case numbers will be less relevant. What will be very, very relevant is how many people we're keeping out of hospital and how many people we're keeping out of intensive care and how many people we're keeping alive.
Last question, please. Last question, please. You said that, I mean, everyone in this state is working towards this 70% target. It's clear looking at these vaccination rates, and it's a positive thing. But are you giving a guarantee that if we do hit that 70% mark, even if we are recording case numbers as we're seeing right now, and these case numbers should continue to climb over the coming weeks until we do reach that target, are you giving people in this state a guarantee that they'll be out of lockdown and out and about despite the high case numbers?
Can I say I was very heartened, without disclosing too much, about the conversations we had at National Cabinet. There is a national plan that talks about greater freedom at 70%, greater freedom, living freely at 80%, and I'm heartened by that. And I'll continue to work with our colleagues to make sure we deliver to the community on those targets, and that is absolutely the key. But what we're also saying, and what the public health team, whether it's Dr Chan or Dr Gale or Dr McAnulty, say, the lower the case numbers when we get to 70% double doses means the more freer we can live there, and at 80% double dose, the lower the case numbers. And again, that also relates to keeping people out of hospital. But when we get to 80% double vaccination and we've vaccinated the vulnerable people, we've vaccinated everybody who wants the vaccine, then that gives us the opportunity not only to live life freely, but not to be in fear of further lockdowns, because we'll know then, when you've got vast majority of your community protected, that the case numbers might continue to rise, but people in hospital will go down and the number of deaths will go down. And even now with the vaccine, when Victoria had the huge breakout last year, they didn't have the benefit of the vaccine, and there were hundreds and hundreds of deaths with fewer case numbers. But what we've seen now with the pandemic in this phase is the tool of the vaccine is stopping people dying. It's keeping people out of hospital. Even though case numbers are higher, we've had far less hospitalisation, far less people dying. Is it a worry that the system is stretched? Of course it is, and that's why we're working hard to stop the spread, reduce the people in hospital and save lives. But let us not underestimate the power of the vaccine. Let us not underestimate the power of having high numbers of our population vaccinated. And let's not underestimate how good life will feel once we get to that. And it is now a journey where we have those details of the targets. I can tell you where New South Wales will be at. We'll be at 70% double dose by the end of October, 80% double dose by mid-November, so long as everybody keeps coming forward, and I'm confident we will. Thanks, everybody. Thanks, everybody.